this is part two of your CNS med table. In the last med table, we focused on primarily the barbiturates, the benzodiazepines, and the muscle relaxants, all of which act on the central nervous system to either create sedative, hypnotic properties or sometimes anesthesia, and if an overdose, they could lead to death. Um, Muscle relaxants are not as potent as compared to barbiturates or benzos, but when all of these drugs are combined or given in a cocktail, if you will think that way, then there's potential for severe respiratory depression and death. Also, never good idea to mix with any of these central nervous system depressant drugs with alcohol. So let's move on to talk about anti-epileptic drugs, or you can call it anticonvulsants or anti-seizure medications. And the next class of drugs would be the anti-Parkinson's drugs for this med table. So what do you know about seizures? Seizures or seizing of activity, right? So these come from the term of increased or abnormal electrical activity of the brain, primarily which is thought of being originating from differences in the sodium, potassium, and calcium ion channels when there's exchange of these charges between, the cells and the cell membranes, and there's action potential. Those are nerves are act, and because of abnormal activity due to various causes, there could be seizures. Epilepsy is actually a chronic or recurrent condition where there's frequent occurrence of seizures, and convulsions primarily refer to the movement or uncontrollable movements that happen during seizures, right? Skeletal facial convulsions, which some of you might have noticed. And status epilepticus means when someone is unconscious for long periods of seizures. If they have consistent prolonged periods of seizure activity, we call it status epilepticus. So from a nursing standpoint of view, it's good to know what the differences are between these terminologies, but more importantly, what these drugs can do to patients when you give it to them, and what would you note for? So if you look at these classes of drugs, you do see benzos. You see that? You see barbiturates. So examples are the PAMs, the benzodiazepines end with PAMs or the LAMs, and then you have the barbiturates which end with the barbitol. In addition to that, you have other drugs. Some of them are gabapentin, which is primarily used for seizures, not for very severe type of seizures, mostly partial, not for grand mal seizures, but to start off with mild seizure-like activities could make the MD or physician or healthcare provider prescribe a gabapentin to start off. Lamictal or the lamotrigine is another group of drug that could be used, and valproic acid and carbamazepine. That's the tegretol. There's one more drug that's the phenytoin or the dilantin. If you want to remember these drugs in terms of their toxicity, it's very important to know. Just like any CNS drug, these drugs have potential to cause changes in the nervous system, right? The central nervous system. So it's important to teach the patient to be very cautious as to the amount of drug taken, and that it'll take longer time to cause any effect, and they should be tapered slowly, and they have to be managed within a narrow therapeutic level. Because why? If there's severe changes, obviously there could be, mental status changes, visual problems, mood changes, and more notoriously, some of the drugs like valproic acid and dilantin or phenytoin, which is not here, can cause gingival hyperplasia, meaning gum bleeding as well. So make sure you read these nursing implications, and some of them are teratogenic. Teratogenic, that means pregnant women should not be taking these medications, and do not abruptly stop these medications. Teach the patient to be cautious while driving. Never do any other CNS depressant drugs, and that they need to come in for their lab levels of the drug done maybe periodically according to the provider's discretion and recommendations. So the next part is anti-Parkinson's drugs, which I will cover in another 5-minute audio. Thank you.